On today's episode, we are going to speak with Julie Perez, who's a physical therapist. Julie is an at home health coordinator who helps patients when discharged from the hospital and also helps to coordinate various aspects of care within patients' homes. Hi, welcome to Health Journeys, a podcast about real human experiences in health and medicine. I am your host and healthcare advocate, Maritza Hasty. Health Journeys is all about discussing the diagnosis and treatments of diseases and exploring personal stories in pursuit of overall health and well-being from different points of view. Support for this podcast comes from Hasty Storytelling. Hasty Storytelling is a creative agency that specializes in production, brand strategy, and live streaming solutions. For more information, visit us at hastystorytelling.com. Hi, everyone. Welcome to Health Journeys. As we adjust to the new normal of working from home, our bodies become much more vulnerable to subtle injuries that can lead to long-term effects. On today's episode, we have Julie Perez. She is a physical therapist who is going to give us some great tips on how to create a healthy work environment, as well as talk about her role as a home health care coordinator. Hi, Julie. Welcome to the show.
Hi, thank you so much for having me.
Thank you for being here. So, Julie, give our listeners a little bit of background about yourself so that they can get to know you a little bit. Can you talk a little bit about your training, your education, and how you ended up in physical therapy?
Okay, so I have my master's degree in physical therapy. I went to Fresno State. I have my bachelor's degree in exercise science. And so I was an athlete in high school, and when I had a fall in basketball and dislocated my knee, I had to go to physical therapy. So at that time, I was exposed to what physical therapy was, and I really wanted to be a doctor, and I kind of evaluated things at that time because physical therapy was so much more 9 to 5 and a little bit more on like hands-on. You could talk to people a little bit more, and I just really fell in love. So that's where I got my degree, was Fresno State. And so I moved down to San Diego, and I've been doing physical therapy ever since. I've worked at major hospitals, ICUs, in county hospitals, home health. I've been all over the burn unit, everywhere. So I've got a lot of experience, and it's been a fun ride, and I absolutely love it. So
you have a varied experience. So then tell us about your role today as a physical therapist. What is it that you do today, and tell us about the aspects of your job.
Okay, so today I'm a home physical therapist. I switched over to home physical therapy just to work with my daughter's schedule. She is in a performing arts school, and so the hours were a lot different. So I started working with people in their homes, and I absolutely love it. The patients are amazing. We see mostly people over 65. And so these people are in their homes. There are a lot of very sick people, a lot of people that can't get out of bed. And so it's very rewarding because we really can look at what they need and really help them get to that point wherever their goal is. For example, I had a patient one day. She had 3 years she hadn't been able to get out of her bedroom because she was so debilitated. And so we worked really hard. And then after about 3 months, we were able to get her where she could walk to the kitchen. So it was really amazing, and we all cried that day. So it was good.
Wow, that's quite a story. Wow. So in home health care, first of all, when we think of physical therapy, I mean, traditionally we think of, you have an injury or you have surgery, you go to a clinic, somebody works on you, a physical therapist. So how does this service of being able to have this done in your home, how does that come into play into the whole aspect of physical therapy? How do we get to that point?
Well, over the years, things have changed a lot in hospitals. The hospital stay is very expensive. So what they do is they really push to try and have the patient be at home as much as possible. So family involvement, patient education, working hard on physical therapy while they're in the hospital. And then so we see a lot more patients in their homes these days. And then that way we are able to work towards their goals and keep them home, and it's a safe place for them and they're happier. So it's just partly been a cost thing. It's also a personal thing. A lot of patients would rather rehabilitate while they're home instead of a nursing home or a rehab center. So it kind of meets everybody's needs. And in home health, our company, for example, we have nursing, we have dietitians, physical therapy, occupational therapy. So we cover the full gamut of what you can get in a rehab setting or a hospital. So it takes it all to a different level. So we come to you.
Yeah, no, very nice because it's almost like you can customize it, and again, you can keep the patient at home in their environment. And so can you tell us a
Yes.
little bit about what a typical day is like for you with these patients? Can you kind of take us through what your day is like?
Sure. Yes.
Yeah.
So basically I get a list on my phone at the beginning of the week. And so I call all my patients, make arrangements for our times. And then so I will get in my car, and in the past, before the virus, then I would get to the house, jump inside, we'd get straight to working on their exercises and goals and walking, looking at their equipment, making sure they're safe, teaching family what they need to do to make sure that the patient can progress forward. These days, it's a little bit different because we do have to put on PPE. We need to make sure that we're safe. We want to be safe for the patient. So everybody has to wear masks. We wear gowns. We wear gloves, hand washing, basically as much as possible. So a lot of times I'll ask the patient if they feel comfortable meeting me on their porch or outside. It's a beautiful day always here in San Diego. So we basically are able to get them outside, do some exercises, and work on what we need to try and help get them as fit and functional.
Okay, so you touched on the differences, now with the pandemic and everything that's going on with the virus, but maybe take you a little bit before that, because being in somebody's home, um, it's almost like you become a part of their family. I'm sure you get to know them.
Absolutely.
So can you
Hmm.
maybe tell us if there's a particular story or patient or something that either touched you or really is something that stands out so that we can get a feel for what your experience is like in someone's home?
Well, basically, we are basically a part of every single person's family, and we get to know them, and we need to work with them. We have to basically meet them on their level, so we really have to be good listeners.
Mm.
And it's a therapy on lots of levels, and so we have to try and figure out how the patient can thrive in the family dynamics. So it's always different.
Hmm.
For example, I have a patient who she was 105, and so she lives alone.
Wow.
And her family just, there's nothing they could do to change that. This patient was completely lucid. She was very smart. She wanted to do things her way. She has 3 floors, so she was constantly walking up and down stairs.
Wow.
But she, some at 105, her balance was a little bit off. But we just kept working on everything to try and make sure that she could stay home and be as independent as possible. She'd walk to the store, and so secretly, one of her sons would run over and kind of watch her walk to the store. She doesn't know that, but she's able to do it. So she walked across the street and has her walker with her basket and would get her supplies. And so we just really work as hard as possible to keep people as safe as possible. So our recommendation would be that she might have had a caregiver that could help her with those kind of tasks, but she just really worked hard, and she never had falls with us, at least. So we just want to keep everybody happy and safe. So
105. I mean, it's amazing. So tell us a little bit about her. So you said she's lucid, so she's completely there when you talk to her. I'm sure her house must be interesting. Does she have any interesting stories or pictures or things that you've learned about her in this whole physical therapy and being at home with her?
yeah, well, her house was just like a museum. She kept everything immaculate. She really worked hard at making sure everything was clean. She had all of her pictures up that she was very proud of. So whenever I would go, she'd tell a little story about somebody different. But, at 105, she had lost a lot of family, a lot of friends. So there is a loneliness factor that comes a lot with people that are over 65 and living alone. And so she had her sons with her, but like I said, she's pretty self-sufficient, and she was very specific that she wanted to continue to do everything on her own and didn't want to hear anything else. And so we just worked with her. And so just
Wow.
kind of, yeah, so she was interesting, but boy, so much history, so much that she'd lived through. And so, I have such a high respect for anyone through that generation. They've lived through so much, and we just have to love and respect and listen to their stories, because it's just amazing.
What a wonderful aspect to your job, because not
Oh,
only are you
yes.
providing a service, but I mean, you're getting to connect with people on such a level, and to know
Yeah.
someone of that age is, that's an amazing story. I'm curious, was she thin? Was she frail? Were you guys afraid to handle her? What about the physical part of that? Yeah. Just curious.
Yeah, she was probably, about 5'1", and she was thin. And so I would say she's probably like 115 pounds or so.
Wow.
But I mean, she was just like, ran around that house. I mean, she was just amazing. And so that's the thing is that, age is just a mind frame, and her mind was just going, and she was just going to keep on moving. So, she was an inspiration, and I absolutely loved working with her. Everybody did, our whole company did. And so, it was fun to have her around, but now she's on her own, doing good.
Yeah, what a great story. And you can actually have the opposite. You can have someone, I'm sure, that you've encountered that's, 30 years younger, that maybe acts like they're 100 years old. And here you have this. So I think sometimes it's just a lot of, the perspective of the person and their attitude, and their willingness, right? To,
Absolutely.
yeah.
Hmm.
So
Yeah.
thank you for sharing that. That's amazing to me. So you touched
Yeah.
a little bit about COVID and the pandemic and how your job has changed. And we talked about the PPE situation. So a lot of people experience shortages, a lot of hospitals, a lot of medical centers. Did your company experience a shortage with PPE? And if you did, how did you overcome that?
So our company, for some reason, I mean, we were able to get masks in the mail. We got the N95, and so that would be our main mask. But sometimes, if I am in a different situation where I might be around family, or I would wear a different mask. So we did have gowns that were sent to us. We had all of the equipment that we needed. We were lucky in that regard, but we do not use as much as they do on the front lines in an ICU or in the hospital setting. It's just a daily, change of gown and masks with every patient. And so it's a little bit easier with us in our setting. And so we were given hand sanitizer. So at this time, we hadn't had any problems. I actually took a COVID test myself.
Mm,
Our company is going to be testing everyone in about a month, but I
okay,
just was curious to see whether or not I had it, just because I have been out
sure.
in the community, and because I do see such an older population. I was worried that maybe I had it and
Mm-hmm.
I didn't have any symptoms.
Mm-hmm.
So after taking it, I'm negative. Yay! So
Yay.
for the moment, and
Yes.
so so basically, our company has really covered us well, and I'm really happy about that. And so I think that everybody wants everyone to be as safe as possible. So that's been good on that end.
Yeah, no, absolutely. So since we're on this topic and talking about safety and families and things like that, have you encountered some of your patients that they were afraid to have you come into the home and they wanted to maybe postpone their physical therapy? How did you address that, and what are some of the consequences of delaying therapy? Simply again because they're afraid to have you come or have people work with them.
Yeah, it's been interesting, the entire reaction. So we have a lot of family members that they're more afraid for their parents than the actual patients.
Mm,
So they don't want to have anyone come in their house. They want to make sure that their family's safe. And so we've had a lot of people that have refused service for right now. They said that let's wait another month or two and we'll just check back.
hmm.
And so we completely respect their wishes. And a lot of times we'll do a phone visit And so we talk to them about whatever their condition is, try and give them a home exercise program on the phone, work on whatever we need to do, because safety is one of our biggest concerns. Mm-hmm. So with these patients that are refusing treatment, or more likely it's their family that's refusing it, then we want to make sure that there's no issues with falls, and we want to make sure they do not get pneumonia or they sit too long. Because what happens is when you're in the house, for all of us, is that we might watch, binge watch a whole season of Netflix or something like that, and then all of a sudden you've been in bed for a while. And right. So these patients, we want to make sure that they're not doing that they're getting up and they're moving around. And so I would say, number one, it's the family that has refused, but then at the same time, we do have some patients that don't want to have us in the house. I also see a lot of these older patients kind of don't understand the gravity of what's going on outside in the world, that we're really, on lockdown. Some of them, it's the same old, their day is the same and they really don't go out anyway. And so they're not seeing that, we're wearing masks. And I did have one patient who told me that she got on a bus mm-hmm. and went about 40 minutes to her doctor's appointment, and then got back on the bus and went home without a mask.
Oh boy. And
in the middle of the day, she's using public transportation. She's basically doing everything that they don't want her to do. And right. I had to really educate her and say, gosh, what happened? Where's your family? And she doesn't have any family. She doesn't have any friends. And so she's just doing her thing. And so, I've been trying to educate friends and family. If you see any elderly out in the community, just, say, hey, how you doing? And what's going on? And how can I help you? Because there's a lot of people that are just all by themselves, and it's scary for them. So I would say that, my patient load has decreased. I usually see about 25 to 30 patients, and right now I'm like 5 to 10. And it's mostly because of these patients that are refusing, but mm-hmm. also they're unable to get to their doctor's appointments. So the doctor's not seeing them and seeing that they might need us.
Oh yeah.
So
I can see where you're going with that, because as you mentioned, in the hospital setting, it's happening. The physical therapist comes in, they work with the patient, they're mm-hmm. moving them so that, as you said, the lungs are moving and we don't get the pneumonia. Is there any type of, I know you mentioned education, but is there any type of formal education component or program that goes out either to the patient or to the patient's families or both, so that they can understand, look, we need to make sure that the patient is moving, and this is why? Is there any type right. of formal education that your company puts out for that, or how do you address that? How do you deal with that?
Yeah, so if they've been in the hospital, we always hope that they had physical therapy, that they were sent home with home exercises and all of this education. Right. So if they had a surgery or something like that. Mm-hmm. So if they're in the home and they're just getting weak, or if they have some other issues, diabetes or something that's declining in their health, and they go to their doctor's appointment, really that's what we do. So we are usually going to their house and educating them one-on-one. But like I said, so if they allow us into their house, then we're the ones that are making sure that they are functioning, and prevention of pneumonia and all of these other things. So we just always hope that they let us in. And if not, we can talk to them on the phone. I've talked to so many family members. It's been a big education. I've done lots of video and FaceTime. And so, we're able to get in there and talk to them about things, because they do care and everybody is helping each other out.
Of course.
And so it's just sometimes the ones that don't have anyone to help out, those are the patients I really worry about. So
yeah, no, I can completely.
We do our best.
So, well, and hopefully they will listen to your words, and they will understand the importance of having, you all come in and working with these patients. And so, since we're talking about, COVID and on the differences in safety, I'm going to switch things a little bit, and we're gonna focus a little bit on being at home. So now that we're all at home, not only in the home healthcare situation, but as workers, as students, I want to switch a little bit and talk about your expertise in ergonomics. Can you tell us, first of all, explain what ergonomics is and what it means and how it can affect all of us?
Well, ergonomics is basically the science of creating a structure that prevents injury and enhances function. So, for example, what's happening a lot is that people are creating makeshift desks. They're not used to working at home. They're trying to make sure they're on Zoom, so they're elevating their computers with books like me and trying to make sure that you can see. And so, creating situations where they can, adapt to this, keep working and adapt to their schooling and everything. So that's basically ergonomics. And one of the biggest things is we want to prevent injury. And so with any kind of work or watching computers long time, you get, the cumulative trauma type injuries. And that's when people get neck strains or back issues or wrist problems. So there's a lot that goes into making sure that people are healthy while they're working.
So with that in mind, how do people recognize that whatever it is that they're doing, whether it's, staring at the computer, how can they recognize that they can potentially be setting themselves up for future harm?
I think that the biggest indicator is just, every 15 minutes, people should be moving. So it doesn't matter if you're sitting, you should move a little bit after 15 minutes, stand, take a stretch break, go get some water. We definitely need to stay hydrated right now. That's one of the biggest things I actually talk to my patients about is making sure they're drinking at minimum 4 glasses of water a day. But, of course, we need 8 to 12. And so basically, if you feel like you're starting to get a little bit of pain, then it's almost too late. And so you need to make sure you're aware of that and address it. And so if it's a little bit of back pain, then you need to make sure you check your chair. You need to think about what you're doing when you're not at work. If you sit for 8 hours in front of the computer and then you go sit for another 3 hours, then that's a lot of sitting. So, trying to get some walks, fresh air outside, doing some exercise videos. We definitely have had to be very creative during this quarantine time so that we don't get the quarantine 15 and we, just keep moving. So, that would be the biggest thing is that, and two, if you start to feel some symptoms, if you can get online, physical therapy is always here. If you have health insurance, you can talk to your doctor about it and get somebody that is a specialist in pathology and figure out what the problem is. So there's always that.
Can you also tell us how a physical problem can manifest itself into a mental component as well? Can you draw that parallel for our listeners?
Yes, well, definitely if you don't feel good, then it's depressing. I mean, it's just, if you have a chronic pain issue, something like that, then overall, you want to make sure that you address it as soon as possible. In these quarantine times, it's definitely one of the biggest things that they're seeing is they're seeing rises in suicides, rising in, and battery, things like that. So addressing your issues and talking to someone, communicating, getting online and reaching out to friends and talking to people, doing Zooms and, keeping your health in check. And so I would say that, if you're feeling like you are getting symptoms, address it because your health is so important during this time. And the only thing we could do is be our own advocate because we're not in front of the doctor. We're not in front of other people. We have to really just think about it and fix it on our own and then reach out for help as well.
Yeah, no, absolutely. I mean, it's multifaceted. That's for sure. Julie, I wanted to ask a question about kids. Not only are we working at home, but now we've got a school at home. We've got kids, we have little kids, we have middle school, we have teenagers. How can we, as parents, address this issue with their kids so that the kids will listen? Kids, they like to lay on a bed with a computer or they're not going to sit up straight. So, but what can parents do to encourage their kids to think about this a little bit more?
Well, definitely we all should bless our teachers, right? I mean, they do so much for us and they really are, they're professionals in doing what they do with these kids and keeping them in alignment and keeping them on track. And so, I would say definitely keeping a structure and getting them up in the morning, having their breakfast time, but then they have their math time or their computer time. And I know a lot of teachers have been holding sessions of Zoom so that way the kids can stay engaged. I think that it's a struggle for a lot of us parents to make sure that we keep our kids on track because it's just, they're in a different zone. My daughter is a single kid, so she doesn't have any siblings. So, she gets things done, then she's really ready for a video game. And so, I have to just kind of make sure that she's taking lots of breaks and doing all the work that she needs to do, but also looking at ergonomics and making sure that she's not sitting in awkward positions for hours and doing videos. So I think that it's just, being as communicative again to your kids and just letting them know that you care and you love them and that you're there for them, but they also need to try and participate because it's just a different world right now. And I do see the next 6 months are possible virtual classes for so many. And so we have to adapt and create a new world for everyone. And so it's interesting to see how this transition goes. So
yeah, no, absolutely. And it's a lot because not only are parents dealing with the material, but now to think about ergonomics and how their child is sitting and their posture and, it's a lot. It's a lot to think about. But, hopefully our listeners will maybe start to kind of look at how their child is sitting when they're doing work and, maybe make some adjustments, little adjustments by day, which I think could be tremendous in the long run. Julie, you and I had a very interesting conversation. It was about your mom. And your mom was complaining. Maybe you can refresh and share with us. But she was complaining something about some type of a pain when she was holding her coffee cup. And I'd love for our listeners to understand how something so simple can really cause some issues. So can you tell us the story?
Yes. Well, first of all, my mom will love that we're talking about her right now. but the thing is, so what it was that she kept telling me that her wrist hurt, and she kept saying that her wrist was bothering her, and then I would interview her, and I'd say, well, what are you doing? We'd look at this and that, and I just kept kind of investigating, trying to figure out what was going on with her arm. And then so finally, she was saying, gosh, I think I might need surgery. And I thought, let's get down to the bottom of this. So after speaking with her, and I actually went to her house and looked at her chair that she sits in, the arms of the chair were just a little bit too high. And so when she set her arm down and had her coffee cup, it was basically putting her wrist kind of like at an angle. And then so she would hold it there and watch her shows. And so I said, basically, stop doing that. And then so we looked at her chair. She actually ended up getting a full new chair because the arms were just too high on that. And so she just adjusted things. She modified. She basically had a wrist sprain, and she had created that wrist sprain from doing that on a regular basis. So showing her how to heal her wrist and giving her exercises to strengthen it, and also just avoiding that position, she was able to heal it up pretty quick, like in a couple weeks. And but definitely that's one of the problems, is that we might not realize that you're sitting in an awkward position. We're holding our phones and talking while we're doing something else. We really need to keep our body in alignment because everything is happy in that position. Otherwise, we can create our own strains and problems, and we don't need to be in the doctor's office right now. No one needs to be, doing any of that extra business. So definitely changing positions, keeping fit, keeping moving, all of that helps so much.
So again, the simplest of things with your mom, in this case, a coffee cup, that caused all those issues. So you just mentioned your phone. I mean, who is not on their cell phone constantly all day, every day, whether it's texting or watching or streaming or whatever? Can you tell us about how something so simple as using your cell phone can actually cause some damage, and how it can cause damage to your body, and what we can do to be more conscientious of that?
Well, at the same token, it's, repetitive strain injuries can come from holding things in the same position. If you use the same hand and hold your phone in this position for long periods of time, it gets tired and you start noticing it. I think that making sure that you change positions frequently and keeping, things at a minimum. Also, if you can talk into your phone, I think that that's a good idea, because then that way you're not holding anything and you can keep good posture. Watching your vision, because definitely that screen time can do a lot of damage to your eyes. And so they have found a lot of studies have shown that, you know, you need to make sure you're minimizing that time if you're starting to get eye strain or eye pain. If you start to feel those symptoms, you might have already gotten into the point where you've done some damage. So there's always that. And so I would say that with your phone, it's the same thing. You just want to keep changing positions and minimizing the screen time. I know there's lots of apps that will tell you right away what your screen time was this week. So then that way you can check and make sure it's not more than the last week, that kind of stuff. So I do think things like Zoom and, you know, FaceTime on your computer where you don't have to hold things, then that has helped a lot.
Yeah, so I can see that. I mean, you know, we see it every day, you know, the people with their phones, and it's a constant. So it's just being mindful and understanding and really thinking about these things, which, you know, I think on a day-to-day basis, people just don't. They just operate automatically, like your mom, again, with the coffee cup. It was an automatic. So I think what we want to tell our listeners is to kind of maybe think about what they do every day and how they do it. You know, I basically had a situation where a mouse, the little dot on a computer, using it every day caused a repetitive stress injury on my elbow. I ended up having to have surgery, you know, and I felt the pain. But, you know, again, you just sort of ignore it. You go through life and you do your thing. So I think you shared a lot of really good information to just have people to, you know, really think about what they're doing. So as we close the episode, can you kind of tell us, you know, what are some of the key takeaways of your message today? First of all, with home health care and that aspect of it. And then secondly, how to create healthier environments at home now that we're still in this situation that we're in.
Yes, well, I think that does encompass a lot.
Yes.
Number one for the elderly, I think that what we really want to make sure they're doing is fall prevention, and we want to make sure that they're moving so they prevent pneumonia and other issues that can happen with sitting in one place for a long time. So that would encompass a lot of family involvement, education, try and help your family and look at your family members and see how they're doing. Call everybody on the phone, say, hey, what did you do today? And, you know, if they're not getting up and moving around, we want to help them. You can always ask your physician to do an evaluation for physical therapy in the home if they qualify. A lot of people over 65 do qualify. And so then that way we can prevent falls and make sure that we get to them and work with them every week for about a month and then get them as strong as possible. So in this new activity time that we have is that what we need to look at is basically we have to try and create a new life in quarantine and make sure we're moving and get on an exercise program. We don't have our gyms. We're used to going to the gym, and I used to doing my paperwork at the gym on the bike for an hour, and, you know, I don't have that. So, you know, I actually did end up getting a bike so that I can do that. But, you know, walking the neighborhood, you know, try and figure out some creative solutions, being active online with other people that are inspiring, do exercise classes, Zoom classes. You know, I've seen so many people do some wonderful things, and it's been great. Belly dancing classes, you know, somebody that I know could maybe teach one, and then we can all take it.
Yay.
You know? So, you know, all of that can help.
Yes, absolutely. Are there any resources online that that we can have our listeners maybe refer them to so that they can learn more about ergonomics and setting up their home and anything like that you can share with us?
Yes. I mean, if you want to just look at a basic setup for a computer station, you can go to Ergonomics and just Google the word, and there's a lot of different education and literature out there. Physical therapists will come to your house and evaluate it. So if you, there's a lot of other options these days too that I find interesting. You can get computer stations that have like a Stairmaster attached to it or a bike attached to it. And, you know, I have a friend actually who, her coworker got one of the Stairmasters and started using the Stairmaster every day. And so after 3 months, lost 60 pounds, didn't change a thing. Wow. Kept all the same, you know, eating habits and just being more active. So, you know, whatever we can do to try and make that happen, I think that we do have to be creative. So, and motivated.
Absolutely. Well, thank you so much. It's been great. You had a lot of great information. We learned a lot today, a lot of different topics
Thank
in
you.
one, and we certainly appreciate it. So let's tell our
Thank you
listeners
so much.
just to be a little bit more conscientious and let's have some healthy bodies and healthy minds. Thanks, Julie.
Absolutely. Thank you so much for having me.
Absolutely. Have a good day. Support for this podcast comes from Hasty Storytelling. Hasty Storytelling is a creative agency that specializes in production, brand strategy, and live streaming solutions. For more information, visit us at hastystorytelling.com. Health Journeys is produced by Victoria Bilionis and executive producers Dennis Lovelace and Greg Hasty. Finally, if you're enjoying the show, please subscribe, tell a friend, and visit us at hastystorytelling.com.